everyone. It's wonderful to see you all here at our panel called At the Crossroads of Poverty and Health. I'm Pat Austin, and I'm honored to be your moderator today. And you're going to be very impressed with the panelists who have assembled to talk about this very important topic. First of all, I want to thank Rob Ranieri from the House of Hope. He is the genius who decided that this idea for a panel was a very good one, and who convinced all of the people who are on the panel today that they thought it was a great idea too. So thank you, Rob. Thank you also to Karen Ripper and to the Kane Center. This is a wonderful facility. We're so pleased we can take advantage of their generosity and have our assembly here today. We are practicing COVID protocols, so we're taping today since we have a limited audience. So all of us will be appearing somewhere soon, and you'll be able to find that out from the House of Hope website, exactly how to find us in the near future. Because we're observing COVID protocols and we're all kind of separated here, you may have questions. We're going to ask you to write those questions down on a white index card that some of our wonderful volunteers from House of Hope will provide to you. They'll collect them and give them to me about 40 to 45 minutes into our panel discussion, and I will be the person with the great power who decides what the question actually says. So please, please, write as legibly as you can for my sake. So on to our topic today. I think most of us have a sort of general feel that yes, if you're poor, it's probably really hard to get health care. And yes, if you're not healthy, probably everything else gets to be a little bit more difficult. So that seems to be sort of right intuitively, but we might ask, yeah, but who actually says this? Who has had the time and the means to study it? Well, we could start with the World Bank. They've done national and international studies that show over and over again that people who are in poverty and can't build any kind of wealth or resource network usually have everything else in their lives go pretty much haywire. We've also seen it from researchers at just about every university in this country who have pulled at the strings of some of the things involved in either poverty or in healthcare and found that the knot keeps coming back to where those two intersect. There's a little write-up by the American Academy of Family Physicians that says, socioeconomic, cultural, and environmental conditions result in a high rate of chronic disease, communicable diseases, health risk behaviors, and premature mortality. Well, that's a very nice academic way of saying, yeah, and people die. There is a national group called Healthy People 2030. Their assignment is to come up with some of the data points that would say that in 2030, this is a healthy country. And they found it impossible to do their work without integrating the economic status of individuals along with their economic status. But fortunately, we don't even have to depend on either our intuition or national or international studies, because we have a panel here today of people who day after day are in the trenches, up close and personal, seeing how all of this works or doesn't work here in our very own community. So I'm going to first give each of our panelists a chance to introduce you as to who they are and what their agency is, and then we're going to plunge into our discussion. So Rob, let's start with you.
Sure. So I'm Rob Ranieri. I'm the CEO for House of Hope. Our mission is to empower Martin County residents to overcome hunger and hardship. And we do that through a variety of means. We have food pantries, case management, financial assistance programs, a variety of programs designed for enrichment and progress for the people that we work with. And I guess probably about 4 years ago, everything Pat talked about in those studies is true, and we all knew that. But about 4 years ago, we made a conscious effort to really try to do more with food, which is probably our largest of our service needs. This year we'll do about 2 million pounds of food. across 4 counties. Right now, we're reaching about 7,000 people a month with food support. And then we're also a food bank, so we have about 25 agencies that we share food with. So what we realized is our biggest opportunity to impact health and therefore impact the economic status of the community and the people we serve was to just get right into doing a better job with the food. So part of that was we have now 4 nutrition gardens across Martin County. And while we get some food from them, we really use them more for education purposes to connect with communities and families and really impress upon them nutrition concepts, how to eat healthier, how to stay healthier. We also broke ground about a little over 3 years ago on a production farm out in Palm City. We're using that straight on to get as much healthy food as quick as we can. So the prevailing growing technique we use is all hydroponics, so we can get quick and healthy food products out. And right now we're getting over 2,000 units of food a week off of the farm. And those get shared with not just our 4 food pantries, but our partners as well. One of the goals with our farm was to really start to get to the point where we could see a salad on the table of every soup kitchen in Martin County. And we're making pretty good progress with all of that. So we've really kind of zeroed in on again, using food as that resource. We do a lot of nutrition education classes. We do cooking classes. In our Golden Gate Center of Enrichment, we have a variety of programs that connect back to health and using that as a springboard to improve the economic conditions of the families that we serve. Our studies kind of show us, internal studies and data collection, that if we can get a household healthier, so many other things just fall into place. We often say that when we can get health as a positive equation in the house, the adults are better earners and the kids are better learners. So we put a lot of energy and effort into that as a means for community improvement and economic improvement for those that we serve. And I guess we'll get a chance to talk more about that today.
You betcha, you certainly will.
All right.
And Karen, our gracious host for today.
Sure. My name is Karen Ripper. I'm the president and CEO here at the Kane Center, which is the Council on Aging of Martin County. We've been in existence since 1974 when a group of important folks in Martin County said, oh my gosh, we have a lot of seniors living here, so what are we going to do in the future to help seniors, because we know there's going to be seniors in need, and that was in 1974. So this year is our 10th anniversary here in this building. Our mission is to be the unparalleled resource for seniors in Martin County. And what does that mean? That means that we are the lead agency as designated by the Area Agency on Aging to pull down grants from both the feds through Older Americans Act and the state through the Community Care for the Elderly grants, and also for Alzheimer's Disease Initiative. So between all those grants, that is the safety net, and that's about $1.4 million a year that our case managers determine how best to spend money to keep in the community, to keep seniors out of skilled nursing and in their own homes, or whatever that their own home may be. Maybe their own home is assisted living. Maybe their own home is independent living. Maybe their own home is in their home that has 4 bedrooms and they need to downsize. Maybe their own home, it goes on and is living with their kids. So we as such, our case managers, we have 4 of them who are social workers, and they assess each person for that. There is a wait list, as you can imagine, with how many seniors living in the state of Florida. It's predicted that we'll have 5 million more here by 2030. So in Martin County, over the age of 60, there is approximately 65,000 seniors living here in Martin County. And we designate 60 as the break-off point as a senior and being able to assist. We do have a case manager who does nothing but crisis intervention. It's called the Case Manager Navigator, and she picks up the phone, is referred by many people in the community. She's referred by physicians. Okay, how do I help mom? Mom's getting where she can't drive anymore. Mom, can't afford her apartment anymore. It goes on and on and on. So our biggest signature program there's 2 of them that we have, and that's adult daycare, where we used to have, before pandemic, over 100 seniors a day in adult daycare that needed assistance, whether it would be with medication, supervision, and so on. Or Meals on Wheels, and that program was our first signature program here. Right now, we're serving over 500 homebound seniors and our congregate meal sites, which there are 5 in Martin County. So with that, I'll
Okay, we'll be
Stop.
back to you. And Samantha Suffich, how about telling us about you and the Martin County Healthy Start Coalition?
Sure. So I'm Samantha Suffich. I'm the CEO of Martin County's Healthy Start Coalition. I have a background in maternal and child health, master's in health education and behavior. And so Martin County's Healthy Start Coalition, we are all about connecting families to resources. We serve primarily pregnant women all the way up to children the age of 3. We were created based on legislation about 30 years ago when the late Governor Lawton Chiles recognized that there was a severe issue with infant mortality in the state of Florida. He actually had a grandson who was born premature and very small. And so over the past 30 years, the state of Florida has decreased infant mortality by 32.6% as a result of the Healthy Start Coalition's Connecting Families to Resources. So we are a true coalition. We are community partners that come together at least quarterly to talk about the gaps that are in the community for pregnant women and infants. And then we do provide our own intervention services. So we have about 200 families each year who have home visitation services, either through our Healthy Start Home Visitation, which is located in partnership at the health department, or our Nurse Family Partnership Program. So within those programs, we're always screening for developmental delays within babies, perinatal mood disorders for our moms, and then providing them with health education so that they're able to have a healthy pregnancy, or making sure that they have nutrition and access to fitness resources, and then empowering them so that they can become effective parents by providing them with education on newborn care or breastfeeding education, childbirth education. Additionally, we have our diaper pantry. Over the past year, we've given out about 100,000 diapers to families who don't have access to diapers. There was a great shortage of diapers last year. Even for families who had the financial means to buy them, they could not find them on the shelves, similar to toilet paper. So we're here to make sure that all of our families have access to prenatal care. So we have a couple of programs that we can provide financial assistance to families who might fall in a gap where they're able to, they have their own health insurance, but then they can't afford the actual copays that go on month after month after month when you're visiting your doctor when you're pregnant. Additionally, we partner with the Florida Community Health Center for our prenatal care for the uninsured. And this is a program for families who might not qualify for Medicaid. And so we make sure that they are able to get into prenatal care because we know that that's one of the biggest indicators for someone having a healthy pregnancy is access to OB, access to ultrasounds and all the technology that's required to screen for those potentially poor birth outcomes. So.
Thank you. And Mary Beth Pena from the Health Department.
Thank you very much, Pat. It's a pleasure to be here today. I am from the Florida Department of Health, and I am the Nurse Program Specialist and Certified Diabetes Care and Education Specialist. And I'll talk a little bit about the programs at the Health Department and then focus on those that are related to food and access to food. So we have, starting from the first floor, we have the Environmental Department. We have the Family Planning and STD Clinic. We also partner with Healthy Start, and we have a wonderful core of Healthy Start people at the Health Department. We have school health and health equity, and my role is in the Healthiest Weight program. So WIC is our main program that actually provides food and supplements for families. And I promised Leah I wouldn't bore you with statistics, but I do have a few important notes. So 4,300 clients participated in Martin County WIC last year. I do have a list on the table where I brought over all of the attached foods that WIC participants can get in the grocery stores. Average purchases of healthy foods is $177,000 monthly. We have 550 nutritional counseling contacts from the licensed dietitians. We have certified breastfeeding counselors educating 150 women monthly. And they also have access to nutritional campaigns and access to nutrition education, recipe, and videos online. So Healthy Start and the WIC program is a wonderful way for moms and moms of young children to get services. Our mission, and Renee will be happy that I have the mission in front of me for the health department, to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. And I think today is a really good example of that integration with all of the partners here from their early stages all the way through the elderly. Just talking a little bit about what I do, and you talk about being in the trenches, which is where I love to be. The people in the trenches to me are the most fascinating, wonderful people. So the Healthiest Weight program started about 6 years ago at the health department with the program of having people go out into the community and educate and empower individuals to improve weight. And we're going to be talking about poverty and hunger. I also want to note that many people who live in poverty have targeted messages to purchase and increase the amount of unhealthy foods that they eat. And when you look at the amount of money that it takes to eat healthy, it's sometimes a challenge. So we partner with all different individuals and community groups like the Can Do Family Center, where we teach and empower health ambassadors to learn about healthy eating and then go share that message in the community. We provide diabetes education and prevention workshops. We partner with schools and early learning centers to do cooking classes, to teach families about the 5210 message, which we'll probably talk about more later, but decreasing consumption of unhealthy foods, increasing the consumption of fruits and vegetables, limiting screen time, and trying to avoid sugary beverages. And another important program that we have at the health department that goes along with poor food intake and dental caries is our dental program run by Millie Ruiz, a certified registered dental hygienist. And she goes to the schools and provides dental sealants, fluoride, and just a lot of education about healthy eating to prevent dental caries. So that's just a snapshot of what we do at the health department related to food and nutrition. And again, it's a pleasure to be here today.
So we have an extraordinarily impressive panel. Their organizations and they themselves bring to us a great wealth of knowledge. And I want to tell you, we really structured this as a conversation. None of them are scripted today. They don't actually know exactly what I'm going to ask them. And oh my goodness, I don't know just what they're going to answer. But we all have lots to learn. As we get into our topic today, I'd like to begin by introducing you to my imaginary friend, Poor Patricia. Poor Patricia. She has gotten through her childhood, although there was never enough at the end of the day or at the end of the month. But somehow her family stayed together and eked out some sort of a living, and she's managed to graduate from high school. So now, poor Patricia is 18. She's pregnant. She has no financial resources. She knows she's not going to get in to see an OBGYN because she has no health insurance. And she's got this idea in her head that it's okay because when it's time for the baby to be born, she can just go to the emergency department and they have to take you in there, right? So it'll be okay. But fortunately, poor Patricia has a friend who says to her, you really need to go and see the Martin County Healthy Start Coalition. So Samantha, poor Patricia is coming to visit you today. What are you worried about given her status, and what would you be able to do to help her?
So with poor Patricia, we would like to encourage her to see an OB as soon as possible, because we know that that's, like I said, one of the best ways to prevent a poor birth outcome is making sure that we have a doctor who's overseeing her, as well as making sure that the baby's growing well. So First step for us, we would make sure that she is enrolled in Medicaid. There is the presumptive emergency pregnancy Medicaid that's available to all women in the state of Florida. For the first 45 days, we're able to make sure that women have prenatal care. So sometimes it takes 45 days to figure out if you can get on your employer's insurance, or maybe you find out that you don't have insurance through your employer or your parents in this instance. Maybe her parents aren't able to offer her insurance, but maybe she has maybe she is under the federal poverty level, and she's still not able to keep her, or she doesn't have access to Medicaid because of her documentation status. So for the long term. So we'll make sure that she's able to get into prenatal care. We'll help her figure that out. And we'll make sure that she sees her OB. And when she's at her OB, she'll complete a Healthy Start risk screen. We will look at her economic background, her educational background. We'll look at maybe her family's situation in the home, any sort of complications, medical histories, and then we can figure out if she's eligible for any of the programs that are a little bit more intensive. So we do have locally, there's Healthy Families through Helping People Succeed, which is more situationally focused to prevent child abuse. And then we also have Healthy Start and Nurse Family Partnership, which is more medically intensive. So for a mom who might have a more complicated pregnancy, we can make sure that she has someone holding her hand along the way, and we can make sure that she's getting to her doctor's appointments. If she doesn't have transportation, we can connect her up with gas cards, or helping her get a Lyft or an Uber to some of our high-risk prenatal care providers that are outside of the county, because within Martin County we don't have a great resource of high-risk prenatal care providers. And hopefully she lands into one of our home visitation programs so that we can stay in contact with her and provide that hand-holding, making sure that she's not experiencing any anxiety or prenatal depression might be something that pops up along the way. But also along the way, we can make sure that she has a home. We can connect her, make sure she has access to food, and we have someone who is providing that intensive case management for her.
Real quick, Samantha, if she doesn't find you, if she doesn't get into prenatal care, what are you worried about?
My biggest concern with a woman who does not receive prenatal care is when she does show up to the ER. And she's delivering her baby, and the hospital has no idea what that baby's medical background might be. Those are the babies that are more likely to land in the NICU. They might stay there for a day or two, but then oftentimes that baby might be there for a few weeks. Like leading into this, I was doing some research about the cost of babies, and I was reading one case where there was a 24-week gestation, babies delivered and survived that situation, but then they ended up staying in the NICU for months until they were safe to go home, and that family had a debt of $4 million with medical bills. So even if you are a family who is financially sound, that could completely bankrupt you. So, yeah.
Thank you. So poor Patricia, she really benefited from visiting with the Healthy Start Coalition. She learned some lessons, maybe not all of the lessons. So now she has a couple of children, and just as her own family, at the end of the month, there's never really quite enough. Not quite enough for money or rent, certainly not enough for even the basics, much less anything above that. And she's finding that it's ever so much cheaper to go to the used baked goods store after the day's take and buy the cheap cinnamon rolls and Twinkies for her kids, and it's filling them up. But one of her neighbors says, you know, poor Patricia, this is really not a very good way of life for you or for these children. And so, Rob, somebody sends her over to House of Hope and says, you know, you got to go see those people. So when poor Patricia shows up, what are you worried about for her and her family's status, and what could you do to help her?
So first thing that would happen is we'd make sure that there was enough food for the household and be able to provide that. So she would leave that day with food to make sure that that at least that stress point was reduced to some degree for her and her family. Longer term, she would connect with one of our case management team. We call it Project Hope, and the hope is helping others progress through empowerment. So Patricia would get an assessment by one of our case managers, and that assessment would cover not just her particular situation, but everybody that's in the household. So children, spouse, if her parents are still with her, everyone is part of that assessment. It's very lengthy. It covers 18 sections, questions on the health, transportation, living conditions, education, job skills. So it covers a range, and each of those areas is really given a number value from 1 to 5, with 1 being crisis and 5 being stable. So the case manager would then be able to use that as a roadmap to work with Patricia and connect her to services and opportunities either within House of Hope's confines or out to our partner network across the county. We do, on a typical month, probably about 1,200 or so referrals where we connect clients to other agencies, services, and opportunities. Sticking within our system, we would connect Patricia to our career coaches. Tim happens to be one of our career coaches, our videographer today. So we would connect her to a career coach. They would help Patricia assess what her skills are, what her desire is, and maybe look at careers that would be ideal for her to progress forward. Help her with a resume, interview skills, get online and do applications. So everything soup to nuts on a one-on-one basis that would help her hopefully improve her employment situation. We could do that same service for anyone else in the household that needs it. We'd find out where the kids were academically and what age they are. We have an early learning program at House of Hope for 3- and 4-year-olds where the kids work with a teacher, kindergarten readiness, not just around academics, but around behavior as well. So that way they're more likely to be successful when they have to separate from the household and go off to kindergarten. If they're older kids, we have homework helpers that could assist them after school to make sure they stay on par academically. A range of other health and opportunities at House of Hope too, smoking cessation classes, cooking classes, nutrition education classes. We have English as second language classes. So we could really tackle all of those needs that would loosely impact her career opportunities as well as social and education opportunities for the rest of the family. And then certainly enroll her into our food program where she would get that benefit. A typical family of 4 at House of Hope is getting about $400 or more worth of food each month. And again, focused on healthier options, fresh grown fruits and vegetables, meats, dairy, all the things that you need for a balanced diet and to have a positive health outcome with that. So we connect her to all of those different services, and then most importantly, she'd get on a schedule with her case manager and have access to that case manager beyond the schedule. So if a crisis arises or something new or different happens to become an obstacle for her, she's got a compassionate person who is familiar with her circumstances, who can guide her and support her through anything else that would come up.
And without the intervention of the kind of food and nutrition that you're talking about, what would be your worries, Ron?
Well, so certainly lots of worries. For the kids, again, health and nutrition affects their ability to learn. So those kids would fall behind in school. Likely, if they're not on grade level by 3rd grade, it becomes almost impossible to catch kids up after that. They're learning to read before that. They're reading to learn after that. So that's a huge challenge. Dental was mentioned by Mary Beth. That's another big one that affects so much of the rest of their physical health for the whole family, not just the kids. The challenge always is if they're not doing all of those things proper and having access to the right foods and services and support, certainly it affects health, and obviously it affects economic standing. A lot of what we do, we work with homeless clients. We have several hundred clients that are experiencing homelessness, but we really do a lot of heavy lifting in homeless prevention. And so that would be something that, based on Patricia's circumstances, I would assume we'd be putting a lot of energy and effort into.
Well, thank you. And poor Patricia, you know, she really did try. She tried to do what House of Hope was connecting her with. But, well, it just kind of isn't in her to stick with anything for too very long. And so here she has her children growing older. She doesn't have a pediatrician. She couldn't begin to think of how you would find one or afford one. And going to a dentist is just out of her realm of comprehension. But now the kids seem to be having some health problems and she's not feeling so great herself. So somebody says, well, why don't you go to the health department? So Mary Beth, here she is on your doorstep. What could you do with poor Patricia, and what are you worried about given her circumstances?
Well, I'm going to imagine, I'm going to double Patricia. And Patricia is Poor Patricia, and she lives in Indian Town, and she lives in New Hope Village, and she comes to the health department and finds out that they're only open one day a week for WIC and for family planning. So luckily, we have Florida Community Health Center out in Indian Town. So I'm going to make sure that Poor Patricia connects with a pediatrician and with a physician for herself. And if she doesn't have Medicaid and if she's undocumented, I'm going to remind her that there's a sliding scale fee so that she can get care even if she doesn't have insurance. We also know that Poor Patricia is probably feeling a lot of social isolation. So I'm going to encourage her to come to the Kindu Family Center and get involved in our classes there. So first of all, in order to advocate for herself, she's going to have to be able to speak English. If she wants to meet with her teachers, if she wants to be able to talk to someone in the community, if she wants to defend herself for her legal rights, if she's undocumented and needs to represent herself with a lawyer, we're going to make sure she knows how to speak English. So I'm going to enroll her in one of Sister Mary's English classes. And because she has little kids, luckily Sister Barbara has an on-site daycare center where she's going to be able to take care of the kids while mom is learning. So one of the other things that I'm worried about Poor Patricia is that she probably has a large sense of social isolation. So to become involved in our groups with the Health Ambassador, Women, and Wellness Group, Mind, Body, Spirit, I'm going to encourage her to embrace the power of a group and come to our classes so that she can be motivated, that she can learn the joy of being part of another group and socialize with her peers to get the support of how to improve her parenting skills, to learn more about nutrition, all the things that we're going to be talking about in our Mind, Body, Spirit, Women, and Wellness Group that also connects her to other people in the community. So we're very happy now that Volunteers in Medicine, if she is undocumented, has lifted the restriction that she cannot be seen. So I am going to really encourage her to make that call to Volunteers in Medicine. And if she's too afraid, we'll sit down with her and make the call together. So if she lives in Indian Town, the Volunteers in Medicine is in Stewart, we'll make sure that we access some way for transportation for her. If she has, perhaps she's had some problems with unprotected sex, she has a sexually transmitted disease, she's concerned about having one, I can connect to her with our STD clinic at the health department or at the Florida Community Health Center. And again, that would be free of charge. She wouldn't have to worry about paying. She's worried about her children. I'm going to make sure we reach out to our nurses in school health so that they can assess any of the special needs that the children may have, anything that they can help with. And we can also connect them, if they are without health insurance, to Children's Emergency Resources, which is an organization in the community that provides money for medical needs for children who don't have insurance and for kids that fall through the gap, because somebody might have a Medicaid waiver, or they might have health insurance but they don't have coverage for dental, or they don't have coverage for glasses. So school health will be able to connect them to those waivers so that the kids can get services. And of course, Millie, our dental hygienist, is going to the schools, going to the daycare centers, and making sure that she evaluates kids, make sure that they get hooked up with a dentist or have an assessment. Because so many times we know that people who are in poverty, they're overwhelmed by all the circumstances. So we want to help them. We're not enabling them or taking care of things for them. We're guiding them through a very complicated process that we want, at the end of the day, we want them to be able to stand on their own 2 feet and say, I did it. And I want them to be able to say that I did it, but I also had the support of not only people on panels or people who are have titles or alphabet soup behind their name, but my own peers helped to strengthen me and get me to where I need to be. And that's one of the powerful things. If we want Poor Patricia to come to a place like the Kindu Family Center, it's not only people like Sister Mary and the teachers and the other people who come in and tutor, but it's the power of that group, power of their peers, that helps them to say, we are a community and together we're going to help you get through your problems. So that's Poor Patricia on the western part of the county, which is often forgotten if she was on the eastern side of the county.
Well, how about if we move her back east a little bit later?
Okay.
So lucky Patricia, she has managed to get into enough services and things seem to be pulling together for her. But now we lose track of her for some years because her children are grown, and so all of those services that relate to children, she's not involved with that anymore. Somehow the choices that she makes seem to just kind of reverberate over and over again. Wrong choices, wrong decisions, very few ways of getting ourselves out of some difficulties. But somehow she manages to survive. And one of these days she finds, to her surprise, that she is in fact a senior citizen. But now she's neglected her health. She really doesn't have anything in the bank. She doesn't have really the ability to depend on family. Her neighbors are getting really worried about her. And so you just know, Karen, that somebody is going to say, well, let's send her to the Kane Center and see what they can do for poor Patricia.
Well, first we would make poor Patricia safe for where she's at. Hopefully she has a house and a roof over her head or somewhere to live, because that is the biggest issue in Martin County for seniors, as it is many other families. If she has a roof over her head, we would make sure that she has had physical care, and we have the day medical center where we do see people for insurance, and we do have a sliding scale physicals and visits as well. And that's by board certified internists, geriatricians, to really understand what's going on with someone who is aging. And the nurse practitioners do a great job with their patients as well, because in Martin County alone, there is over 30,000 people with over 3 chronic medical conditions. That's a lot of people with chronic medical conditions, and more than likely Patricia has a chronic medical disease. So we would then assess, is Patricia someone who is at risk for skilled nursing placement in the future? And what can we do at this point to avoid that? Again, we want to keep people in their own environment as long as possible. A skilled nursing residence, if you are in a skilled nursing home, it's about $120,000 a year. Okay, but if you are on one of the care plans from community-based services, such as us, and many of our partners assist us in providing those services, it's about $1,600 a month. Okay, so big difference. And that's our goal, is to be able to identify those folks who are at risk through the helpline, which is through the Area Agency on Aging. It sounds very bureaucratic, and yes, it is. But we do encourage people, we help them with a relative to call the helpline and give a true picture of that person's activities of daily living and their health status, their dependent status, their family status, and so on. We would make sure Patricia has food, and again, we have our Meals on Wheels program. We also have food boxes. We work with House of Hope and Food Bank to make sure that we have those food boxes and anything else that we need. No one ever waits for a meal. We have Michelle, Jacobs, our Chief Philanthropic Officer, and many folks do a great job securing grants to make sure no one ever waits for a meal. Our Meals on Wheels program provides many free meals, even for people that have been admitted to a hospital. We want to make sure that they have food in their refrigerator and meals when they get home. We don't want them going back to the hospital. So the other point that I would like to say is we want to keep people out of the emergency rooms as much as possible. So again, through our day medical center, we do a really good job of, or we would see Patricia if she was ill on the same day and make sure that we do everything we can to avoid going in the emergency room and a hospitalization. Oftentimes when people have a fall or a hospitalization, they tend to deteriorate somewhat quickly. So we want to make sure that not only is her health, her nutrition, but also her social isolation is addressed. We have there is a licensed clinical social worker on staff here, Donna True, who meets with folks to assess what is going on in mental health counseling. If not her, then we recommend to one of our community partners a meeting regarding their mental health. So if Patricia is dependent on medications, we would certainly make sure we work with her, and whatever her means of assistance through Medicare or managed care organizations. More than likely, if Patricia has been on Medicaid most of her life, she would be eligible to be in a Medicaid managed care organization, which is, there's many in the state of Florida. And they do tend to look at the whole person and work with providers such as ourselves to get community benefits for Patricia. Does that answer the question?
Well, of course, there's just so much more that could have happened to poor Patricia, but isn't she lucky to have gotten all of those services to help hold her together? And in fact, in several instances in Patricia's life, isn't she just so fortunate that there was somebody who said, why don't you go to one of these great organizations? So my question to our panel is, what about access? How do people know to come to you? We know because we all know each other and because we attend meetings like this. But many of the folks that we're talking with who don't have resources and aren't really part of the social services grid, how do they even know about you or how to get in there? Mary Beth, how does anybody know that it would be a good idea to show up in Indiantown at the health department?
Well, there's a number of organizations that are working hard to make sure people understand about access to care, and 211 is one of them. The community health assessment in the last cycle, one of the things that was noted was that people were not aware of services. So 211 has done a lot to try to get the message out through all sorts of means of social media, advertising. The 211 number, anyone can call to get information on access to services. Then all of the different organizations that have public relations, or Renee, our public information officer, does a lot with different organizations to make sure that they know what we're doing. We also rely a lot on word of mouth, especially in the populations that I work with. They are more likely to go seek services if someone they know has trusted relationship with those folks. So if somebody goes to House of Hope and they hear something good about what Rob is doing, let's say, or they go to La Jolla, I see beautiful Brenda here, La Jolla, they're probably not going to be reading the newspaper, although they may, but they're probably going to rely a lot more on word of mouth within their community, or if Brenda or one of the people in her staff says, listen, this is a trusted organization, you can go seek out help or care there. So I think word of mouth is the grassroots way of getting information out.
And as we were talking here, all of the panelists have mentioned about how well we would call this organization, we work with the other people on the panel. Rob, maybe you'd like to talk a little bit about collaboration. Mary Beth is saying, well, if they have a good experience from you, they might end up with her or with Samantha or Karen.
Sure, so I think Martin County has a lot of successes with the people that we're trying to assist because of collaboration. You know, the agencies work really well together, whether it's nonprofit, government, religious institutions. So everybody tries hard to connect people into each other's services. Like I referenced earlier, we do about 1,200 referrals out at House of Hope into other partners across the community. No one entity is going to be able to solve problems like what we're talking about today. So it takes partnerships and joint programming and creative thinking to address some of the issues, share and pool resources, whether those resources are financial, programmatic, staff, whatever they may be, to make this work to benefit the people who need the support most. So I think that's one of the things that really separates Martin County from a lot of other communities, is that trust and that partnership amongst agencies.
And Samantha, has that been your experience, or are you sort of a standalone since the services that you give are just for a certain period of a person's life?
I would say we're a coalition. We have community partnerships all the way across the board. We don't work necessarily with the Kane Center very much, but our staff definitely know if it's a multi-generational home that we can refer to them. But yeah, we work with House of Hope. We work with the health department. Our team is placed in the health department, so they are very interconnected with all the services that are available there. I would say our primary referral source is from healthcare providers, so OBs, or even when a baby is born in the hospital, every baby is screened by us. But we do work very well with our staff are visiting the homes, they have rapport with our clients, and moms themselves are very interconnected, even just like in little community pockets, so they know that, similar to what Mary Beth was saying, we have that rapport with the community. So if a mom's friend is newly pregnant, you need to go talk to Gabby at the health department. She'll help you. And then that's how it just basically snowballs and gets them connected with us.
So this is just a very personal relationship, a very personal web that all of our agencies have woven within our community. And Karen, how do then people find at a point in their life that the Kane Center, the Council on Aging, is the place that they ought to go?
Well, we have, so we start with a healthy senior. We have many, many classes that we advertise, and we have a membership, and it's word of mouth in their communities, whether it be a standalone community, a gated community, any type of community. Word of mouth is big. But physicians, again, is one of our biggest referrals. We spend a lot of time talking with physicians. We network with Martin Health through all their programs that we share patients with, and also we look at programs together through as a community that, for instance, Cleveland Clinic Martin is going to be having their fall symposium here. So we try and get people in the building to understand what we do. Because we do so much, it's so hard to describe sometimes in 2 sentences what we do. But we want to be the ones, again, to turn to for that adult child or grandchild to say, oh my gosh, what am I going to do with grandma? What am I going to do with mom? We get our case manager navigator has a huge network of other providers as well that they can refer for different services. I failed to mention the electrical assistance program, and I know Rob at House of Hope also was involved with that. That's another way to get people in the door. When you advertise for different programs and you tell people in the community what you offer, then it's a lot word of mouth.
If any of you in the audience have questions, this would be a good time for you to submit them, and Amy from House of Hope would be available to collect them and bring them up. But in the meantime, I really want to challenge our panel. We've said wonderful things, and we should, about all of the services that all of you provide in the interconnection among agencies. But we also know that when people are poor and they don't get those connections, things go very, very badly. It's fine to say somebody got involved with the Council on Aging, and what if that person didn't? Are we going to first have that person come to our attention when she's dead on the floor of her home? Are we first going to find out that children haven't received the nutrition education they should? when they are in the ER with very desperate illnesses. So I pose this question to you. What opportunities do we have for those areas in our community, in our service network, where really people could still fall through the cracks? What could or should we be doing? Karen, you're nodding?
Yes, I am. I'm a nurse, been a nurse for 46 years. Spent a lot of time in Cleveland Clinic, Martin Health, and I remember when public health was when we had nurses in the community that went from door to, knew their community and went from door to door, whether you're an old person in the community or a young person or a growing family. We need boots on the ground in different communities to know the communities and identify people at risk, and that's what we're trying to do. Our vision is to get there, especially for older folks. It's difficult, but in the long run, it's an ounce of prevention is worth a pound of cure, so to speak. Rob knows his communities. I mean, they're seeing more, but we need, for instance, Banner Lake. Look at Banner Lake and Hope Sound. They know their community. It's a small community. However, we need to replicate that throughout the county. That's my opinion.
Rob?
Sure. I mean, there's always gaps. You can't be everywhere and be everything to everyone. So I think what we try to do as a group across Martin County is to close as many of those gaps as possible. And a lot of it goes back to what Karen just pointed out too, have community leaders that are observant in the neighborhoods they live in and understand enough about the network and the opportunities of services to make those connections with people or with their neighbors or for their neighbors sometimes. You know, that's a big part of how people find us. It's somebody comes to us and tells us a story about someone who lives down the street for them, or someone who they work with, or a child that goes to school with their child. So taking that information and acting on it, you know, obviously has a lot of value to prevent people from falling into those gaps. But you know, I mean, there's, as good as we may be, we can always be better, and I think that's certainly everybody's goal is to prevent those kinds of circumstances like you just described, Pat. And I think we get better and better as a coalition doing that. We've engaged the religious community, we've engaged our local doctors, Cleveland Clinic, you know, on and on. So everyone, or as many people as we can, make aware of the network, the web that's out there, and put people into the right spots at the right time.
One of the questions from our audience goes right along those lines. It says, what do your organizations need from the community? Donation, volunteer hours? How do we help spread the word? Samantha, what do you think we're still missing?
So a little bit touching base on the previous question as well. I know that we are connecting with 82% of moms during their pregnancy and 90% of infants. So there is a gap that we're missing in our county. And what we can do primarily is raising the awareness for our organization, making sure that people know when they get pregnant that they need to get to an OB. That is for us the primary point of contact and entry into all of our services from us, and we triage all the way out. So that would be the biggest thing, raising the awareness for moms when you find out you're pregnant within that first trimester to go to the doctor. That's the biggest thing that you can do. And then also when your baby's born in the hospital, consent to services. Consent for us to contact you just to see what's going on. A lot of moms don't even realize that they might have breastfeeding issues until day 4 or 5, and they've already said no, so then it makes it a little bit more difficult for us to get involved. But also, funding is always really helpful. That helps us sustain our programs for the long term. We're funded through Medicaid and the Department of Health and some local grants as well. But having more diverse funding keeps us sustainable, especially when we know that legislation changes year after year. It helps us continue our services.
And Mary Beth?
I think one of the big issues for poverty and hunger and also obesity is looking at social determinants of health and also understanding that people who live in poverty, whereas before it was an issue of being underweight and calorie scarce, and now I think we have to have an understanding that social determinants of health and poverty are going to affect people's ability to have nutritional foods. And so I think House of Hope has done an incredible job about changing what's in the pantry through the gardens and increasing their vegetable. But we really need to look at how can we help communities that are living in poverty to have access to healthy foods to help decrease the incidence of diabetes and chronic diseases. Because obesity is linked to poverty. And I think the other thing is when we look at policy and we're looking at people that live in poverty, people of color, are more likely to be targeted for eating unhealthy foods. So understanding that it's really important that we have policies in place that limit the amount of advertising that can be done towards children or people who are already living in poverty and have decreased access to healthy foods. When we look at, previously we talked about food deserts, when people who are in rural areas or in impoverished areas don't have access to healthy foods or they don't have access to grocery stores. What we see now is that people that live in poverty are now having food swamps. That means lots of unhealthy fast foods and convenience stores that sell maybe a few healthy items, but the majority of the items sold are unhealthy foods. So people understanding that they can have SNAP benefits, but also getting education so they can understand how they need to avoid all those unhealthy foods that are going to lead to chronic diseases.
One member of our audience reminded us of this quote: "If you give a person a fish, they will be filled. If you teach them how to fish, they can eat for their lifetime." So the question is, so what can we do to educate people? By the time they get to you, of course, your door is open. You have wonderful people behind those doors to help them and to get them into the services. Is there anything that we can do prior to their coming to you in I won't say a state of disrepair, but already in a bit of distress? Now, there's a great question. Anybody want to direct?
There's such a labor shortage that we can partner as agencies with learning centers on how to develop trades. For instance, our adult daycare is in dire need of certified nursing assistants. We're working with the different schools for CNAs to try and get them here for a clinical experience. We've got to identify early on, try to work with the schools, identify what the needs are in the community, and each agency participate. I know, Rob, you have we all have interns for whatever trade that is applicable to our being, but go out and seek more of those internships, is what I'm saying, as agencies.
And of course, if we expect that people will come to us, sometimes we can be sadly disappointed.
Mm-hmm.
So, Rob, you might want to mention a few things about what you do rather than wait for people to come to you in distress.
Sure, and I think what we're trying to do right now is really be proactive and preventive. So a range of different partnerships, some of them are more unconventional, I think, than others. Like, for instance, we have a great partnership with the Humane Society of the Treasure Coast. So pet care and pet food, those are things for a lot of our clients, especially our seniors. They would forego their own health to make sure that their pet is fed and healthy. So we try to take those kinds of burdens away. But even prior to that, before people realize they need or end up needing services from any of us, there are steps we can take. So Karen referenced internships. There's some great opportunities in our community with the American Recovery Plan money that comes from the federal government and passes through the county. And that's really being targeted right now towards upskilling our community. So that affects many of the clients that we all serve. So taking kids that are not going on to college after high school and helping them get in line for a career rather than a job, a trade skill or other kinds of a more defined skill. So they're not depending on a fast food kind of wage, low wage existence. Taking adults that may be already in those low wage positions and putting them on a path to upskill them for some of the job opportunities that exist across the county in the trades or in the medical field, which is constantly evolving here, and really setting them up for that success. So if you can increase household income, you can prevent that spiral into a lot of the other challenges that we see around physical health, mental health, and housing. They can be in a better situation with that roof over their head, like Karen referenced earlier. So, preventive is really a big part of it. And beyond that, too, our model for us, we're an empowerment model. So, it's easy to feed people. That's the easiest thing we do, honestly. It's hard to feed them well, and then it's even harder to get at root cause and figure out why did they need our support in the first place, and how do we position them for that steady progressive improvement so they won't need us for the long term.
So, Mary Beth, is there anything you wanted to say on that topic of prevention? Obviously, we've seen that our agencies are superb in helping those people who come to them and need help. If the goal were to try to prevent some of these situations, you before had mentioned policy changes.
Yes, I really think that when you look at obesity and you look at the problem of the food choices that people make, it's a lot more complex than just eating too many calories. And if you look at, say, a family, many of our families are working 2 jobs. They're making minimum wage, and if they're undocumented, they may be just being paid under the table. So the food that they're choosing and the activities that they're choosing to do to maintain healthy weight and exercise may be limited by exhaustion, depression, conflicting responsibilities. So I think policy in terms of livable wage, so that people do have time to recreate, they do have time for relaxation, to be able to spend time with their family is very important. I also think that we need to make sure that we empower children to know that they are being targeted, just like the tobacco industry is targeting people to smoke. And one of the things that they used for preventing kids from smoking is to let them know that they were being manipulated. So when you teach kids about being savvy and media smart, about looking at commercials, looking at, hey, why is there more commercials for soda on programming that is targeted for young black and brown teens than for other non-brown and black teens? So helping kids to understand that they have power, that they have the ability to make choices, and having the ability to make a healthy wage, to make a living wage so that they can get a good job. All these things are intertwined, I think, to having a healthy lifestyle.
Which is kind of where we started from, isn't it? That these things are really intertwined. And thank goodness we didn't bribe any of you with donuts to come here today. I want you to remember that.
We have stuff in the bistro.
Samantha, any comment that you wanted to make on our discussion here?
Yeah, so with Healthy Start, we are a universal program. We are a universal prevention program. We are not income-based. So we know that with pregnancy, there are risk factors, definitely, but at the same time, it's not, a mom who is very well off might have some pretty severe medical complications, so she can participate in our programs, but at the same time, we definitely see a lot more low-income moms because we know that their situations are a lot more complex. So we do know that getting into prenatal care, like I keep harping, is very important because we know that it prevents those babies from being born too soon, too small, and when that baby is not allowed to have its brain develop to its full capacity, then we're having to deal with developmental delays. 1 in 3 babies that are in the NICU need some sort of additional intervention when they're in school. Mm-hmm. So that is making it so they're academically struggling. And then in the long term, that's impacting their ability to be employed well. So if we're able to either prevent a cycle or break a cycle by making sure that everyone is starting off with an equal opportunity for good health, I think that's how we can have one of our greatest impact, just starting in the beginning.
When this panel was announced, Rob got a lot of calls from other nonprofits saying, well, hey, how about us? We have some really important information. that we could add to. Now, I have two questions here that I don't think we're going to really have time to answer today, nor do we have those particular expertise, sets of knowledge on our panel, but we might then want to think about, should we do this again, and should we talk about some of the other aspects? For example, there's a question here about homelessness. Now, intuitively, we might say, well, if you're living in a disastrous situation, perhaps mold, perhaps unsafe from violence in the area, perhaps at a distance from where you can get to anything that would really help you. Wouldn't homelessness or poor home living impact this and your health as well? And so the question is specific numbers on homelessness. Karen has referenced finding adequate shelter is a big problem in our county. Perhaps that's something that we want to explore on another panel. And another question here asks about mental health issues. Well, of course, we could talk for the rest of the day on mental health issues and the link with poverty. I know from working with New Horizons that an individual with mental health problems is most likely to die by 58, far lower than the average of 75 to 80 for most of us. And without the ability to hold a job, of course there's poverty, and so therefore there's poor health. So we have lots more in our tangle. As I mentioned to begin with, every time a researcher pulls at one little strand of either poverty or health, suddenly the whole knot is there of how interconnected they are. So we're going to throw this at Rob, but maybe we want to come together and do this again with some other panelists. But in the meantime, we've already gone a bit over our hour. Before we start here, I want to really thank our panelists for bringing us so much information today, and Tim for doing so much to get us on tape so that people who couldn't come will be able to learn about this someday. And I'd like to give each of our panelists just one last chance to say whatever it is that's on their mind at this point. Karen?
I think the panel on homelessness and mental health is extremely necessary. The average person who has a rough time through life is going to only have about $700 a month to $800 a month from Social Security when they meet their retirement days, and that's just not going to do it. And homelessness, if we can achieve the homelessness situation or help people find housing, it would take off so much burden for folks.
Thank you. Meredith?
And following up on the homeless issue, with the rising cost of housing in Martin County and the limited amount of housing, it's a big, big problem. I would totally agree that, and Brenda's here today, so she'd be the perfect person to talk to afterwards. And I am remiss in forgetting one ginormous piece of the health department, and that is our Department of Epidemiology. I think I was desperately trying to forget that there was COVID for at least a few minutes, but sorry for not mentioning that if Poor Patricia had a positive COVID test, she would be followed and given lots of support for testing and all of the things that we provide. So sorry to Leslie and the Epi team. I was pretending COVID didn't exist for a few moments.
We all appreciated the relief. Thank you. And we'll give Rob the last word, so Samantha will come to you.
Sure. So, so I think that when we look at poverty, it is impacting a lot of our families. We need to make sure that they're getting paid a livable wage here in Martin County, as well as addressing the need for realistic housing costs for those wages. And then when we look at our moms on Medicaid, that's about half of our population. So the legislation just recently expanded Medicaid to moms beyond just those first couple months of pregnancy. It's giving them a full year of coverage, which I think will have a long-term impact on those moms having healthy women's wellness going forward. But we do know that for every baby that we have that is born full-term and healthy going forward, that saves our local economy $65,000 each.
And Rob?
Sure. Well, first of all, thank you, everybody, for coming out to be a part of this today and for some of the great questions. You know, I think the topic on homelessness and mental health certainly is a worthy one, and I think all of these ideas of how we can get people in a room and just educate and learn from each other are going to make a difference in our community. As I said earlier, no one agency can solve these issues, so it's really going to be about agencies coming together, about the public having more awareness and empathy and compassion for some of the challenges that people are faced with. There's a lot of myths, and we didn't really get into some of that today, but there's a lot of myths around our lower income population. They're not all sitting home collecting extra benefits because it's COVID, or eating government cheese or whatever. Our clients that we work with at House of Hope, they don't want to be in the situation that they're in, and they're trying their best to improve and move ahead and get out of that. And I think that's more typical of what we see in the lower income community, whether they are housed or not, whatever other health or education challenges they face. They want to be better and they want to move ahead. So these kinds of opportunities are what's going to fuel that and give us the support we need. You read that question earlier, from somebody about volunteers and financial and all those things. The answer is yes. Like, we need all of that kind of support. We're all volunteer driven. We couldn't do the work we do without volunteers, because we definitely wouldn't be able to afford the payroll necessary. So there's so many ways for us to be a part of the solution in the community. I would just encourage everybody that is here today or watches this after the fact, seek out the agencies that connect with the things that you're passionate about improving in the community and help us improve it, because that's how we'll get better. So thank you again for being here today.
Great, thanks. So I like to quote Wicked every once in a while, the line that says, "Thanks to you, we have been changed for the better, and now it's up to us really to go out and see if we've been changed for good." Thank you all. We'll see you next time.
Thank you, Pat.